energy devices. In this, I will show some slides to you all. Basic definition is electrosurgery is the use of radio frequency alternating current to rise cellular temperature as a way to vaporize or coagulate the tissue. And this is the principles. All you know, this current is flow of electrons past a point in the circuit per unit time. It will be measured in amperes, and voltage is the difference in electrical potential between 2 points in the circuit, that is force required to push a charge along the circuit, that will be measured in volts. And impedance or resistance, it is the degree to which a circuit resists the flow of electrons, that will be measured in ohms. And power, it is the amount of energy per unit time, that is a product of voltage and current, that will be measured in watts. Energy, this capacity of a force to do work, that will be measured in joules. And this is the Ohm's law. This is the basic law. I is equal to E by R. That means E, where E is voltage in volts, and I is current in amps, and R is the resistance in ohms. And three basic principles of electricity. First one is electricity always takes the path of least resistance, and second one is electricity always seeks ground, and third one is electricity must have a complete circuit to do work, where without closing a circuit, electricity does not work. It always requires a closed circuit. And here this electrosurgery generators take 60 cycle household current and increases it to the radio frequency range. This range is 2 kilohertz to 3.3 megahertz. And the adverse effect of muscle and nerve stimulation were overcome by the use of high frequency alternating current. Based on Motion's observation in 1881 that oscillating current at a frequency of 1 lakh hertz could pass through the human body without inducing a pain, spasm or burn. It was also noted that temperature elevation was proportional to the square of the current density. Modern day electrosurgical units use frequency ranges of 20 kilohertz to 50 lakh hertz, because this allows for desired thermal effects without muscle fasciculation or nerve stimulation. Because this frequency is the range of amplitude modulation radio waves, the energy used in electrosurgery is also referred to as radio frequency or RF currents. One of the electrosurgical unit here I am sharing. This electrosurgical unit, you can see all the accessories are included here. One is here main unit, foot switch, and return electrode, that will do, that we can call it as earth pad, and bipolar forceps, pencil, that means a cautery pencil or electrosurgical pencil, and all the here you can see all the accessories whichever is available. Electrosurgical unit a 60 cycle per second, that is 60 hertz, low voltage alternating current into higher voltage radio frequency current. In the system components, this is the main system generator. These are the inactive electrode and grounding pad, and also we can call it as a return electrode. In the active, there will be this one is the inactive electrode or earth pad or grounding pad. Normally we will call it as a grounding pad or return electrode. This is the active electrode. First one is the monopolar electrode, and second one is the bipolar forceps. And this is the complete circuit of this total electrosurgical unit. Here you can see this patient is lying on the bed, and will be connecting this indifferent electrode in the downwards, and it will be going to the our electrosurgical unit. From there again will be connecting this active electrode that will be used for cutting or coagulation of the skin. Actually, we will be using this monopolar in the monopolar system. Includes two separate monopolar instruments in the circuit, the active electrode and the dispersive electrode, between which is interposed the entire patient. Patient will be there will be active electrode and the pad, earth pad. In between this two, patient will be placed. The active electrode is designed to focus the current or power on the surgical target, thereby creating the desired tissue effect. The dispersive electrode is positioned on the patient in a location remote from the surgical site and is relatively large in the surface area, a design that serves to defocus or disperse the current, thereby preventing tissue injury. Actually, this return electrode, it should be placed in the proper place, otherwise there will be some burn will happen to the patient. Sometimes it may give the shock to the operator also. Active electrodes can have many designs, but those with a point, hook, narrow tip or bladed edge are generally used to concentrate current and power for the purpose of tissue vaporization and cutting. When the active electrode has a slightly large surface area, such as the side of a blade, or when it is shaped like a ball or is in the form of a grasper, the same output used for cutting will result only in local coagulation. Consequently, can be used for hemostasis. This is the dispersive electrode and grounding pad. There are different types available. Normally we'll be using two split electrodes mostly. We'll be preferring two split electrodes. Dispersive electrodes are almost always designed with an adhesive to facilitate continuing contact with the patient and prevention of a clinically significant local thermal effect. However, if there is a partial detachment, the current or power density will increase and the dispersive electrode can become active and capable of creating thermal injury. often called a burn. Sometimes if the return electrode is not attached properly, or if it is coming, if it comes out, then it may injure the patient because it will become active. A return electrode burn occur when heat produced over time is not safely dissipated by the size or conductivity of the patient return electrode. That is, burn is equal to current into time by area. Usually this is in the form of a split pad, which effectively is to disperse. A difference in the measured impedance in the two dispersive electrodes will generally reflect partial attachment or detachment, and the machine will not start, or if already on, then it will shut off automatically. Nowadays, we can see all the electrosurgical units. If it is written electrode is not attached properly, means it will give the alarm. REM pad or earth pad disconnected, like that, alarms will come. So we have to check this electrode, then only this electrosurgical unit will start. And this is the how return electrode works. Like dispersive electrode, the so-called split pad that allows for the detection of a partial detachment if the electrosurgical unit is capable of measuring and comparing the impedance in each electrode. Here we can see two split pads. If this one side is disconnected, then also we'll get the alarm from the machine. So we have to check whether it is properly pasted or not. Sometimes adhesive will be loosened, and it may not be conducted properly. This is the bipolar forceps. This bipolar uses two tinned bipolar forceps. One will be active electrode, and the other one will be the return electrode. A fundamental concept is that only part of the patient involved in the circuit is the tissue interrupts between the two electrodes. A design that prevents complications related to current diversion and provides more accurate measurements of local tissue parameters such as temperature and impedance. This is the bipolar forceps connection. Like for this, we doesn't require earth pad connection. That means the return electrode is not required for this one, because already it will be having electrode in this bipolar forceps. And the tissue effects, normally we will be using for cutting. So in the cutting, formation of a tissue incision with radio frequency electricity is simply the process of linear vaporization. Vaporization of tissue is best achieved with a continuous low voltage waveform using a unipolar instrument with a narrow pointed or blade shaped electrode held near to but not in contact with the tissue. And the generator is activated, allowing the thin electrode to concentrate the current and therefore the power at its tip, a higher power density. The current then arcs between the electrode and the tissue, rapidly elevating the local intracellular temperature to more than 100 degrees Celsius, causing focused cellular vaporization and the creation of a local plasma cloud of steam ions and organic matter. Because the voltage is low and the current dissipates rapidly with distance from the active electrode, The thermal damage on each side of the cut zone is minimal. Desiccation or coagulation. Two simultaneous processes occur when tissue temperature is maintained at 50 degrees Celsius for at least 6 minutes or instantaneously at 60 to 95 degrees Celsius. Protein coagulation and dehydration or desiccation. The cellular proteins are altered but not destroyed, while two distinct intracellular effects are occurring simultaneously. Many use either the term coagulation or desiccation to describe both processes. In conjunction with properly selected power outputs, the power density is high enough to cause instantaneous coagulation and desiccation. Although any waveform may be used to create tissue coagulation and tissue desiccation, a continuous low voltage output, that is cut, results in a predictable zone of coagulation with higher quality and consistency than that achieved with the output labeled coagulation. Compared to low voltage waveforms, the modulated coagulation waveform result in an uneven amount of protein bonding, limiting the ability to, for example, achieve complete occlusion of a blood vessel. In addition, such waveforms cause the more superficial layers of the tissue to become rapidly coagulated, increasing the impedance, thereby preventing further transmission of the energy to the deeper layers of the tissues. This is the active electrode you can see, and downwards between we are having the skin, and that means patient, and depressive electrode will be connected downwards to the patient. Coagulation with low voltage continuous waveform, it is a cut. You can see side waveform will be like this. The process of tissue coagulation is best achieved using a continuous low voltage output. You can see here non-conductive insulator it is there. This figure demonstrates the impact of modulated high voltage waveforms on tissue. When coagulation is attempted, the intermittent output from the waveform causes a brief and superficial elevation of tissue temperature sufficient to cause focal coagulation, desiccation, and in many instances carbonization. The next time a burst or arc returns to this area, the tissue impedance has risen sharply, so the current is blocked or diverts to a less impedant zone of the tissue. Fulguration. This is fulguration is a process whereby the tissue is superficially coagulated by repeated high voltage electrosurgical arcs that continue to elevate temperature by resistive heating to beyond 100 degrees Celsius, reaching levels of 200 degrees Celsius and more. In addition to coagulation and desiccation, there is a breakdown of the organic molecules into their atomic components, including carbon, that results in the addition of a dark hue to the coagulated tissue that is called carbonization. This process probably requires local temperature of 400 degrees Celsius or more, has also been described as spray coagulation or black coagulation. The active electrode is held a few millimeters away from the tissue at a distance sufficient to allow ionization of the media in the electrode tissue gap, with subsequent establishment of visible arcs between the two structures. Here you can see active electrode and non-conductive insulators, then depressive electrode. Normally, this is the how cutting, pulverization, and desiccation, that is coagulation, images. The outcome, minimal collateral coagulation, low voltage, and 100% duty cycle, pure cut it will be. Electrode speed relatively fast and keep in steam envelope. Outcome, second outcome is modest collateral coagulation, moderate voltage, 100% duty cycle, pure cut or blend, electrode speed moderate, keep in steam envelope. Outcome, third outcome is modest collateral coagulation, carbonization. This is a high voltage, low duty cycle, coagulation output, electrode speed slow, and keep in steam envelope. Modes of operation of molecular electrosurgical unit and waveforms. Here you can see a cut current supplies high frequency current non-interrupted with low voltage. A clot current, that means coagulation, supplies an interrupted wave current with high voltage. In this case, the electro generator supplies power only in 6% of the time, while in the remaining 94%, the generator does not produce power, allowing the electrode cool. These on-off cycles are called duty cycles. The high voltages obtained in coagulation mode lead to visible voltaic arcs, which creates a superficial coagulation, carbonizing the surface, increasing tissular impedance and not allowing the diffusion of the thermal effect in depth. This phenomena is called fulguration, and the clot current should be used only to obtain the effect. That is, when there is a diffused superficial bleeding or oozing. A blended current is just a continuous cut current which is interrupted by creating several on-off cycles, that is duty cycles. Blend 1 means that electrosurgical unit supplies power only in 80% of the time, while in the remaining 6%, the generator does not produce current. Blend 2 means that electrosurgical unit supplies power only in 60% of the time, while in the remaining 40%, the generator does not produce current. In blend 3 means that electrosurgical unit supplies power only in 50% of the time, while in the remaining 50%, then generator does not produce current. When the current is interrupted, namely when the duty cycle decreases, the watts are kept constant, but the generator increases its voltage. That is W is equal to V into I. That means, sorry. And as a larger follow of electrons will cross a tissue with generator side thermal effects. Greater hemostat effect, but also a greater tissular damage. This is how you can see cut, blend, and coagulation. If the thermal speed are increasing, then coagulation will happen. This waveforms will be there. For the pure cut and bipolar, a waveform will be very faster. 100% electrosurgical unit will be in on condition. And in blend 1, you can see 50% power will be 50% it will be on and 50% it will be off. In blend 2, 40% it will be on and 60% it will be off. Like blend 3, 25% it will be in on and 75% it will be in off. In the pure coagulation, 6% of mission will be on and 94% the power will be off. not complete mission. It is the internal cycle will be adjusted. This is the basic principle. You can see whatever previous slides. After it is like a conclusion. We can say conversion of electromagnetic energy to mechanical energy. That will be frictional forces. Then it will be converted to thermal energy. This is how they will be using this cut coagulation. And here you can see a simple thing that cutting means it is a vaporization, and coagulation it will be like more than 100 degrees Celsius of heating the tissue. Nowadays we can see this advanced vessel sealings like in the electrosurgical unit will be seeing only cutting, coagulation and bipolar. Now this vessel sealing is the advanced technique now for all the surgeons are preferring. You can see in this vessel sealing, as the name of suggests, vessel sealing in the, it will be like a bipolar advanced technique. Involves the sealing of vessels like arteries, veins or tissue bundles. So to upload the blood flow in that direction, and then cutting in the sealed part. Like if we keep tissue between the two electrodes, it will be with force, it will be applied current, and it will be sealed, then it will cut. The main parameter in vessel sealing are high pressure and high current. The tissue to be sealed has to be held under high pressure by closing the ratchet at the proximal end of the accessories, and high current is passed so as to seal the desired tissue. In this method, the elastin and collagen fibers gets denatured and forms a white color substances with which is termed as seal. Vessel sealing devices can seal vessels up to 7 mm. This is like COVID and one of the vessel sealer. This is the how it will be. There will be force applied with the proximal pressure, and two electrodes will active and return electrode will be in the same place. We can heat up.
Hello.
So
Yes, sir. We had lost you. Please continue. Hello, Kiran sir. Am I audible? Because we cannot hear you. It seems that you have lost your connection. Hello. So anyway, Kiran sir has he was almost done with his slides. So I would request Mr. Ravi Patel to take the charge and just hello.
Yes, sure.
Yes.
Yeah, Abhishek.
Thank you, Ravi.
Thank you, sir, for the a wonderful presentation on electrosurgery devices, monopolar, bipolar, and you were about to cover advanced bipolar device like vessel sealers and ultrasonics. So, to brief about my overall introduction, I'm Ravi. I'm product manager for energy-based devices in Medtronic. So we have all the products which are having effect through any kind of energy, like electrical energy or a mechanical energy. And also we have surgical safety device like smoke evacuator. So I deal with that product portfolio. And as like the product portfolio which has an application in almost each and every surgical procedures. So without wasting time, I will just quickly move to our main topic, which is ultrasonic energy device. So as you have seen that we have energy-based devices like monopolar, electrosurgical devices, bipolar. Then we also have sonicism, which is ultrasonic dissector, and ligashore vessel sealing device. So why surgeons need all of this? And the main reason is because they want to have different application on the tissue in different procedure. So if whenever they want to coagulate with surface coagulation or to, have a cutting effect, they will use monopolar, which has a vessel size limit of around 1.5 millimeter. So they can do have a clinical effects of cut and coagulation within the 1.5 mm of vessel sealing. Whenever they are using bipolar, there is a limitation up to 1.75 to 1.8 millimeter vessel size, and till they can seal the vessel with only bipolar devices as well. Then the advanced energy devices evaluation happen. The sonicism ultrasonic dissector, which is ultrasonic energy device, has a capacity to cut and coagulate the vessel sealing size of up to and including 5 mm in size. So whenever surgeon wants to dissect only with faster speeds and also simultaneously want to have a coagulation effect, then they can use ultrasonic dissector, which are based on the mechanical energy principle. But when they want to seal and cut the 7 mm vessel size, like uterine artery in TLH, IMA in lower anterior resection, they want advanced bipolar device, that is ligashore vessel sealing devices. These devices can seal and cut the size up to and including 7 mm, and that's how they get a confidence on ligashore whenever they are encountering higher size vessel. These devices are helping us to reduce the usage of sutures also, and also give the confidence to the surgeon that the vessel sealing will be secured and it will not result into the leak. Now let's see how does the ultrasonic devices work. What are the basics of ultrasonic energy? As sir has explained right now, that how electrical energy works, and the energy travels between the jaws and the protein denaturization happens. Here in ultrasonic energy also protein denaturization happens, but it's with the heat which is generated through the vibration of the active blade. So this video is a beautiful video which will explain how the electrical energy of battery is converted into a mechanical energy that vibrates the active blade, and the heat is generated through the friction and the vibration of the active blade with the tissue, and then the protein denaturization happen. So I will just play the video for 2-3 minutes.
Ultrasonic technology in surgical procedures is the use of ultrasonic energy to dissect and coagulate tissue. A conversion from electrical energy into mechanical movement produces an active blade that simultaneously cuts and coagulates. Varying tissue effects such as dissection or coagulation are based on tissue type, amount of time energy is applied, pressure, tension, blade geometry, and displacement and technique. Inside the sonicision generator is a piezoelectric ceramic stack, which is excited through the application of electrical energy. The electrical energy is turned into mechanical motion, which is distributed down the shaft of the device and amplified. The system oscillates at 55,500 cycles per second, and maximum displacement is achieved at the blade tip. When the blade comes in contact with tissue, the pressure causes coaptation and coagulation of blood vessels. Hydrogen bonds are broken. Protein in the cells is denatured and vessels are coagulated. The sticky coagulum that forms is then essentially a glue that seals tissues completely and hemostatically.
So this is how ultrasonic energy device works. If you have seen the active blade, which vibrates in a linear fashion, and the frequency of vibration is at 55,500 per second. So that's how it is in a very big number, and that's how overall heat is generated through the friction, and that helps to have a tissue effect of dissection and the coagulation. In our Sony Season ultrasonic dissector, so Sony Season first generation device was launched in 2013. That is world's first cordless ultrasonic dissector. We had received a Red Dot Award for the medical design. At the same time, we also got Gold Medical Design. So Red Dot Design Award and Gold Medical Design Excellence Award were awarded for the Sony Season cordless ultrasonic dissector, because this was the world's first cordless device where the bulky generator was just converted into a size of a size which can fit into the palm of the surgeon. There is a freedom of movement to the surgeon, and surgeon can control the energy modality within from the sterile field and without asking anybody to change the power setting from the generator. Everything is hand switched, and that's how the cordless device actually was first cordless device was launched by Medtronic. In our Sony Season, we have two energy modalities. Surgeon can have effect of minimal and maximum mode. So how minimum mode and maximum mode are different? Like in minimum mode, active blade has less displacement. So if you can see here, active blade will not travel to the next position. Actually, it will just travel lesser position, and it will have a lesser displacement, have a lower velocity, and when it is used when lower dissection and more hemostasis is required. So whenever surgeon wants to coagulate tissue and doesn't want a faster dissection, they will use in the first position, that is minimum mode. And whenever surgeon wants more dissection, more higher dissection and lower coagulation, they will use the maximum mode. That's how the minimum and maximum energy mode are decided.
Display.
And what are the factors which affect the dissection effect? Those are based on tissue type. So if the thicker tissue is there, then it will take some time. Amount of time energy is applied. What is the jaw pressure? How the pressure in between the jaw is also important. Tissue tension, whether there is a traction on the tissue, and also blade geometry. Is it straight? Is it curved? And the finally displacement and tactics. These factors are manipulated, and then the amount of friction between active and tissue controls the tissue effects, like more coagulation or more dissection. And here in 2020, on 15th of August, we have also launched our next generation device, that is Sony Season Curved Jaw Cordless Ultrasonic Dissection. So on generation 1 was launched, we got some feedback from surgeons and biomedical engineers about the changes which will help to make ultrasonic dissector better and to compete with the leader in the industry. And that's how the new device was launched, because we feel that surgeon can't afford to be tied up in the OR. The more freedom will help them to focus more on the procedure rather than worrying about the wires. So cordless vessel sealing and dissection device in procedures help surgeons to reduce the tripping as hazards, also facilitate easier instrument exchanges in between the procedure. It also improves the procedural focus, because everything is in the control of surgeon only. There is no need to ask a scrub nurse for anything. There is no wire, so no need to worry about the wires whenever they are rotating the device. entangling of wires can actually can result into the tripping of the device. It also helps to have more natural movements, like the device or the shape of the dissector is made in a way that surgeon feel that it is like they are just holding a handle of the cycle. That's how the overall design of the dissector is made. And this is how our curved jaw is designed. The curved jaw has a shape which has been developed from the voice of customer of many surgeons around the world, that how many degree of curve is needed to have a proper dissection. And that's how this kind of curved jaw was defined. If you can see here a Teflon. So Teflon has a better durability and it has a support from both the sides through the jaw. And this, we have got very encouraging feedback from the surgeons that quality of Teflon is very, very good, because this is very much important in any ultrasonic dissectors, because this is the place in between which active blade and the Teflon actually active blade and the Teflon, there is a tissue in between both of them, and that's how this Teflon is very much important. It also gives access to the curved places, access to the target tissue. And if you can see here, the single button intuitive action, because the single button will also provide minimum and maximum effect. Minimum mode is the first position, maximum mode is the second position, and minimum mode will give more of hemostasis and less of dissection. Maximum mode will give more of dissection and less of hemostasis. It will help surgeon to focus more on the patient, more on the procedure, and can control this energy modality in between the case, in between the step as well. Whenever they have clamped the tissue in between, they want to switch mode from minimum to maximum. It is very much possible here, which is not possible in foot switching device. How is the feedback of our device? So we have found that 100% of surgeons said that Sonicision curved jaw device is intuitive and comfortable to use throughout the procedure. Also, our next generation reusable battery pack, which is having 88% greater capacity and also have double the procedural cases. Now the battery has more life, 200 cases are there in one battery. So it will reduce per procedural cost. And also the generator has more procedural uses. Now it has 1.5 times more case than the generation 1 device. So 150 cases per generator. And it is auto washable and it is autoclavable for streamlined cleaning and sterilization. Autoclave is available in almost all OR of the hospital, and this device has very simple sterilization method, and that has also we have got the appreciation from the surgeons and the biomedical engineers wherever we have got the initial success. I will just play a small video of Sonicision curved jaw, which will again help us to understand the benefits of these devices.
Experience the evolution of freedom of movement. From the trusted name in cordless ultrasonic dissection devices. Introducing the redesigned Sonicision curved jaw cordless ultrasonic dissection device. The cordless design reduces the challenge of managing cords in the sterile field and provides freedom of movement and mobility during your surgical procedures, contributing to a safer and more efficient OR. Available in 4 shaft links to help meet your specific need, the Sonicision curved jaw cordless ultrasonic dissection device enables secure vessel coagulation and efficient dissection in open and minimally invasive surgical procedures. The tapered design of the curved jaws enables precise access to tissue planes in confined spaces. The intuitive dual-mode energy button is designed to improve focus on the surgical field and procedure. The Sonicision curved jaw device has an improved reusable generator that is now autoclavable and enables 1.5 times more procedural uses than the legacy device. The improved battery can be used in twice as many procedures. The redesigned charger features a user interface that provides easy-to-interpret battery charge status and battery end-of-life indications, enabling efficient battery management. The non-sterile nature of the battery also removes the need for sterilization and streamlines preparation for reuse, and provides an 88% increase in battery capacity. which may mean fewer procedural delays due to mid-case battery exchanges. The Sonicision Curved Jaw Cordless Ultrasonic Dissection Device. Feel the freedom.
Yes, so this was our Sonicision Curved Jaw Cordless Ultrasonic Dissector. So if you can, this is our overall design of the device. The generator is just a small part which converts the electrical energy into the mechanical energy and the shaft through which the active blade vibrates. The battery is now non-sterile battery. So how it is helping? Because in earlier version we had a battery which needs to have a sterile or the plasma sterilization, and in that case the time was getting lost in between the procedure and the sterilization, because the battery first needs to be charged and then sent back to the CSSD department and then it comes. So some of the battery life was getting lost. Here, through the help of battery insertion guide, the non-sterile battery is only being inserted from the charger, so that 100% capacity battery will come into the dissector, and that is helping us to improve our battery life also. And most of the complex cases like Whipple's, lower anterior resection, radical hysterectomy, only one battery is enough to do these cases. And even we have got feedbacks that one battery is able to do more number of cases even with the single charge. So that's how the battery life and intraoperative battery life also is very improved. And also it has 200 cases, so it has a life of 200 cases. We have a warranty of 200 procedures or 1 year. If it is not working till that, then we will replace the battery. We have a reusable generator which is now autoclavable, and the torque has been made integrated. Earlier the separate torques needs to be taken for ultrasonic dissectors, where the torque is used to tighten the fitting of the ultrasonic dissectors and the generator. So now it is integrated, and the 2 clicks will be guiding us that it is properly fit and tightened with the dissector. Battery charger, it is very much important that battery charger can now empower 4 batteries at some same point of time. Imagine in an OR or in a multi-specialty hospital, so there are more than one OT where you need to use ultrasonic dissector. Then there is no need to buy 4 different bulky generator like other ultrasonic dissector, but you can only have one battery charger and then have a one battery and one generator. You can equip 4 OTs with only one generator simultaneously. So this is a huge cost saving and cost effectiveness in the current times, when the capex budgets are in lots of constraint around the world. And this device is further helping us to reduce the per procedure cost, capex investment, and at the same time having a quality ultrasonic dissector. Whenever battery will have a less than 20 cases, it will start showing the number on this digital mark, where it will show that now 20 cases are there, 19 are there, 18 are there. So you can reorder the battery. It is like a normal mobile charger. There are 5 levels of charging which will be shown. Every bar has a 20% of the battery charge status, and it will charge the battery in 1 to 1.5 hours fully charged. So that's how overall battery and battery charger design has been made. This is our intuitive dual mode activation button for transition between minimum and maximum from the sterile fill itself. This is our curved jaw design as being shown here. And we have 4 shaft lengths available: 13 centimeter, 26 centimeter, 39 centimeter, and 48 centimeter, which will be very useful in the bariatric cases. So open procedure, laparoscopic procedure, and the bariatric procedures, or the surgery in the obese patients. So that's how overall Sonicision device is designed. So with this, I'll say that feel the freedom in ultrasonic dissection with Sonicision Curved Jaw Cordless Ultrasonic Dissection, because this is the future of energy device. We are getting innovative products which are helping surgeons to focus more on product, more on patient, more on procedure, rather than worrying about the things which can be left to medical device players and community like you who will take care of this. So I will be ready to take any questions or any other suggestions on the same.
Yeah. Thank you so much, Ravi. Thank you so much for this insightful presentation. Actually, we have some questions in Q&A.
Okay, let me just see the,
Yes.
okay, I will just go through this. So the question is, I'm coach from MPSA Nairobi. I'm asking if you can share this document. Okay, reference for the first is, what is the major drawback about the device? As I said with you, all the benefits. The major drawback, if I can share, is that it needs proper handling. So it has to be taken care properly within the OT, uh, with all the benefits that it can transfer within the procedure during the procedure, or it can be transferred to another OT after the case. That's how the cordless freedom works. Any mobile surgeon who wants to do procedure in more than one hospital, they can just carry this device rather than carrying a whole bulky generator moving here and there. Plus, there are no AMC and CMC, because this is there is only one capital item, which is a charger, which has no life, while battery has 200 cases of life minimum, and generator has a minimum life of 150 cases. Once the life of, and there is a warranty around attached to it, either number of cases or 1 year, whichever is earlier. So during the same time, you are getting a new generator and new battery after these procedures are number of cases are over. So no expenses on CMC, AMC, and you are saving the money today. And in current times in capex, you are saving as much as money as you can with ultrasonic dissector with this device, rather than investing in a big bulky generator. The next question is, curved jaw dissector is battery operating? Yes, our curved jaw ultrasonic dissector are also battery operating. So battery actually gives a power to generator, and generator is the main item, another, which converts the electrical energy to the mechanical energy, and that's how the through piezoelectric current, and that's how the active blade vibrates. So it is battery operating. How will the ultrasonic probe be sterilized, or it is a single use probe? So as you are aware, these are single use devices as far as labeling is concerned. But as in India, every hospital, majority of the hospitals has a tendency to reuse in some of the case. But as far as label the use is concerned, it is single use. The next is, what is difference between electrical surgical unit and energy platform? Force FX is electrosurgical unit and FT is energy platform. So it is, Force FX is electrosurgical unit, FT is electrosurgical unit with vessel sealing and bipolar resection. And why we are calling energy platform, because these are the platform which has we launched after almost 20 years. Like Force FX was launched in 1995, and FT was launched in 2006, and then another FT10 was launched in 2014. So it is kind of a branding exercise. That's why we are calling it, is not just a electrosurgical unit, but it has tissue sensing, tissue sensing technology, which actually measures the change in the impedance of the tissue at 434,000 times per second, and then changes the power delivery accordingly. So there are tissue sensing technology components also added to the FT and FT10 platform, and that's why we named it as a FT10 energy platform. It is not just a monopolar and bipolar cautery device. There is a lot to it in this FT device. What is the difference between normal bipolar and vessel sealing? What benefit for doctor and patients? So as Mr. Kiran sir also explained, this is also normal bipolar devices has a vessel sealing capacity up to 1.8 millimeter vessel size. Till that, surgeon can use bipolar devices and seal the vessel. But if the size of the vessel is increasing, then surgeon needs to first tie through sutures, then to do lots of burning and charring of the tissue, and then they cut in between. So bipolar devices doesn't have a knife within it. They are just a bipolar forceps. After the sealing is done, surgeon has to enter another scissor, and then scissor will cut the tissue in between. While our ligashore vessel sealing device has an independent cutting and sealing. So whenever sealing is only required, surgeon can just seal the device, seal the vessel, and then see whether double sealing is required or not. If they want to be double sure, they can do another sealing, and then they can take a call to use cutter or the knife by pressing the trigger, and that's how the cutting or the cutting will work in between the seal length. So bipolar devices first limitation is a vessel sealing size, and the second is they don't have a cutter in between. While in vessel sealer, they have cutter in between along with the device. Fewer instrument exchanges are required, and they can seal up to and including 7 of vessel sealer. So ligashore is appreciated for the same. The next question is, what is the lifespan of the battery for ultrasonic dissection system? So lifespan of the battery is minimum 200 cases. That's how we have tested in our R&D and lab, and that's how we are giving a warranty on this pieces for 200 procedures. Cost of the equipment. So basically, I will still again say that cost of the equipment depends on the configuration of the device. So like it can range from 10 lakh rupees to 12, 13, 14, how many batteries you are taking, how many generators you are taking, and how many dissectors you are taking along with the device. But the minimum basic cost of the device, which is like one generator, two batteries generally, or one dissector, one charger, will cost around 10 lakh rupee plus taxes. So what are the sterilization consideration put in place for this device as again the contamination? So if you can see Sony Season dissector device, you can say it is I have got a feedback from surgeon that it is you can have a complete sterility in this device. How? Because one is dissector is sterile piece, generator is autoclavable, non-sterile battery is getting entered into the dissector with the help of battery insertion guide in complete aseptic manner. There are no cords attached to the device, and whenever there are no cords attached to the device, there is no chances of getting the sterility compromised. Because how the cords are working, because cords, so one part of the cord is attached to a generator, whether it is a bipolar device, monopolar device, or a ligashore, or the another ultrasonic dissector device, which is corded. In that also it is attached to a generator, and that's how the corded device is not sterile, because that is going to a dissector. Here everything is completely sterile. The whole system is completely sterile. Do radiological scan test needs to be carried out on patient to know particular device model to use? Yeah, so when pacemakers and a kind of a device are there in the patient, surgeons try to not to use a electrical energy device, so that there are no RF signal issues. And mechanical energy devices, because there is no energy going in the patients, they are more safe. That's how they feel, and they are using the ultrasonic dissector whenever there is a need to operate on the patients with the pacemakers. What is the difference between normal dissection and ultrasonic dissection? So normal dissection can be done through a dissector, like a reusable or a disposable dissector, which are not using any kind of energy. So surgeon just manipulate like a artery devices in between the tissue, and they are getting a dissection. So whenever they want a blunt dissection effect, they are using in open procedure, they use artery device, or in laparoscopic procedure they use a laparoscopic dissector. But very few surgeon will be there who will be there who are using the only dissectors in a laparoscopic cases, because that is only helping to make the tissue and just making a space, freeing, but it will not seal because there is no energy between. While in ultrasonic energy device, it will cut and coagulates also in between. So there is no blood loss or very less blood loss in case they are having a bleeding issues. Does the usage of ultrasonic dissectors increase the chances of hospital acquired infections? No, I don't think that ultrasonic dissector usage increases the chance of hospital acquired infection, because it is just another medical device or the surgical instrument on the trolley of the surgeon. And overall, it is the single use policy of the hospital will help us to reduce the hospital acquired infection, because the single use devices once used are disposed of. When the reusability of the devices are there, then in case very few cases it can turn into the hospital acquired infection. Another question is, what is specific difference between electrosurgical unit and ultrasonic energy? Do ultrasonic energy use sound system like ultrasound? So yes, so electrosurgical units are based on the principle of radio frequency generator, which converts the normal electricity power into energy in kilohertz, which actually gives the effect of electrical energy and the thermal effect on the tissue. The protein denaturization happens in both the modality. In electrical energy also, the protein denaturization happens, uh, and in ultrasonic energy also protein denaturization happens. Difference is how the protein denaturization is happen. In the electrical energy, it is through a heat which is generated from electrical energy, while in ultrasonic energy, it is through a heat which is generated from vibrations of the active blade. So that's how both the devices generates the heat through a different way. Which part of the Sony season are able to sterile and non-sterile? So battery is non-sterile, charger doesn't need to be sterile, only generator needs to be sterile with autoclave, and there are battery insertion guide, which is a component coming up along with the system, which needs to be sterile. We also do have optional system called sterilization tray, in which both the generator and the battery insertion guide can be placed and can be have a autoclave sterilization with the or without the use of reusable sterilization tray. So only generator and battery insertion guide needs to be sterile, and the rest of the part like battery is non-sterile, ultrasonic dissector is a single use by the label. Can you explain a bit about the coagulation mode and it is possible with this device? So it is like, how minimum mode, when the blue button on the device is pressed for in its first position, so it gives more of coagulation. And whenever surgeon wants more of coagulation, they don't want a faster dissection, but they want to coagulate and have a hemostasis effect, because there are some minor ooze in the tissue. So they will use a minimal mode. Whenever they feel that, no, I just want more of the dissection speed, I want to dissect the tissue faster, and I don't feel that the tissue are having lots of blood, I would say, circulation in it, and it will not result into the bleeding. In that time, they will use the maximum mode and they will do a faster dissection, and it will have a lesser hemostasis effect. Is it possible to add optical camera to a device for a better visual? So like, optical in laparoscopic surgery, already camera system is providing the visuals, but in open surgery procedures, the control is already there in the surgeon's hand, and it is very much visible to the in the range of surgical field. So if you want to record the case, then the camera on the OT lights can help to record the case. But as far as functioning and the visualization of the target tissue is required, optical camera may not be required. other innovative device based on ultrasonic energy. So the first device of ultrasonic energy is QSA, which was launched way back in 1986. Then actually Tyco or the auto suture launched the first ultrasonic devices in the, I would say, industry, which was autosonics. If some of the surgeons in India are using that autosonics device, which was based on ultrasonic dissector. Then there is a harmonic by Johnson and Johnson, which was launched in 90s. And then Sony Season is based on ultrasonic dissection. How to control the frequency of the ultrasonic signal generator. So basically 55,000 cycle per second is the frequency. It is going to be same in any of the effect, whether we are having minimal energy effect or a maximum energy effect. The frequency will remains the same, because that's how the ultrasonic energy devices in Sony Season works. What is changing is the displacement of the active blade. In the minimal effect, the displacement will be lower, and on the maximum effect, displacement will be the higher, but the frequency will be the same. So in the maximum mode, the more heat is generated because of the higher vibrations at the with the higher distance in the same time. So that's how the maximum mode gives a more of dissection effect. Is that warranty applicable for battery, generator, dissector? Yes, so warranty is there on battery and generator. Battery has a warranty of 1 year or 200 procedures minimum, whichever is earlier. Generator has a warranty of 150 cases or 1 year, whichever is earlier. Dissector is a single-use device. The next question is electrical energy converted to mechanical or ultrasonic? So electrical energy is converted into the ultrasonic energy. The ultrasonic energy is actually giving the mechanical vibrations. So both are interrelated. First, electrical energy is converted into ultrasonic energy, and the mechanical movement of the active blade is generating the ultrasonic effect. Why the jaw is slightly curved? Because whenever surgeon use a straight jaw device, it doesn't give a view of at the top, that at the top of the device. Why they are not able to have a complete visualization? Whenever they use a curved jaw device, surgeons have a complete view of the target structure and to the tip also. So that's how curved devices are more preferred by many surgeons. But still, many surgeons are also using straight jaw device. Majority of the surgeons like the curved jaw. What is a battery backup? How much time? So as I said, battery backup, one battery is able to have a complete procedure of like 6 hours or 7 hours based on the evaluation which we have got done, and there was no requirement of changing the battery. Few cases has gone up to 8 hours also, and we have no need of changing the battery, because battery power also depends on how many times the device was used in between the cases, how many times the minimum and maximum mode was used. So basically it depends on many things, but as per the experience, one battery is enough to do most of the complex cases currently being performed. So we have not got any cases so far in India after the launch where we have got complaint that in between the cases the battery was needed to be replaced because battery power drained off. So that's how 88% battery capacity has been improved. So how many times we can use the ligation instrument? Again, label use is single use. What is the period of coagulation of the device on the ceiling? Do you think the coagulation process is faster? Yes, so we have got feedback from the surgeons that the device is having good speed, and it is having Indian surgeons specifically. They told that you have a better coagulation because the hemostasis is very good whenever even we are using a maximum mode. we are not getting any bleeding issues, and your hemostasis part is very good. So coagulation is good part of overall thing. What calibrations or QA are required for device? No calibrations are required for this Sunisizen curved jaw device, because it is plug and play device. Once all the components are there, it is ready to use. There are no repairs which are required, because it is completely all the components are separate, and it is coming up with the standard warranty by the company. If any part is faulty during any time, it has to be replaced. What is the difference between LigaSure and BiClem? So LigaSure has the capacity to seal up to and including 7 mm vessel size. Plus it is having the integrated knife as well. And sealing is independent of cutting. And it is in the same instrument, you can have cutting also, and you can have sealing also. While in BiClem, it is a sealer, advanced bipolar sealer. They also claim to have 7 mm vessel sealing size, but for cutting them, you have to use another scissors. What website can be used to purchase the device from another country? So you can reach out to our global www.medtronic.com, and you can search a Sunisizen curved jaw cordless device. You will be routed through our global website, and you will get your request will be forwarded to the concerned person. Another question. In the product, we just saw a beautiful presentation of any damage or tissue found in the curved jaw joint or revital joint, or the long neck can be repaired or replaced, or they are purchased in cases. So in curved jaw, so jaw is a part of the dissector, which is a single-use device. So once the single device is not getting used, or after in Indian scenario, after some reuse, some cases, the dissector is not working properly, then the new dissector will have a new job. It is not a kind of only jaw can be replaced. It is whole dissector. It is coming as a unit. What kind of battery is used? It is a lithium-ion battery, like a mobile batteries only. It is like a lithium-ion battery only. Which one is better, cautery machine or ultrasonic dissector? I will leave it up to Kiran sir to answer this question once I will just complete mine one, because it again depend on surgeons, hospital, what kind of surgical techniques they are using, what kind of benefits they want to have on a patients, like a lesser blood loss, a faster procedure time. So all this can be happen through ultrasonic dissector or the advanced bipolar device. Since the battery is non-sterile, it is used to sterile operating. Just a minute. It is used in sterile operating area, whether sterilization is required, and yes, how is sterilized before the surgery. So it is used in sterile area, but circulating nurse actually enters the battery into the dissector with the help of battery insertion guide, which will ensure complete aseptic transfer of the battery. So there is no requirement of sterilizing battery. Non-sterile battery is only getting entered into the dissector with the help of battery insertion guide. And after the battery is inserted, the door is getting closed. So non-sterile battery is not coming into contact with either the scrub nurse or any part. So these are the question in the question and answer. I will request Kiran sir to take few questions regarding the electrical energy and ultrasonic dissector, or in the chat box if you sir can share some light.
Regarding this, which one is better, cautery machine or ultrasonic dissector, means it completely depends on the procedure which we are going to perform. Like if it is a CT surgery, so again we need both. if it is cautery mission and dissector is there, means so surgeon can use this ultrasonic dissector in major vessel sealings, and cautery mission they will be using in the skin, skin opening. Yeah, that I feel. So cautery mission will be used in different scenario, and ultrasonic dissector will be used in different scenario. It completely depends on the surgeon's technique.
Thank you, sir.
Thank you, sir. Thank you so much. And thank you so much, Ravi, for addressing all the queries. And I want to especially thank Kiran sir for taking time from his busy schedule and having this great presentation with us. Thank you so much, Kiran sir, once again. And
Thank you to all by giving this great opportunity from all the team members.
Yes. Thank you, sir. Thank you so much. And I would like to thank once again all the participants for joining in on the time and making it very interactive session by asking so many questions. And once again, I just want to reiterate that as I have already said that we will be sharing the certificates post this program. Once the program gets over and you leave this webinar, you will be redirected to a web page where you need to fill in the required information and submit the form so that we can get your information, as in, for example, what do you want? Exactly what name is supposed to be on your certificate. So your certificate will reflect the same information. So please be vigilant while filling that form and don't forget to fill that. So thank you so much, and thank you so much, Ravi, once again. Can I just end the session here with the permission of Kiran sir and Ravi?
Yes, sir. Yes.
Yes. Please.
Thank you for
everyone.
the valuable time of all the participants. Thank you.
Thank you.
Thank you so much, all.